Hi, I'm Dr. Bhargav Raut from PathoFast Lab in Pune. A lot of patients ask us whether they should do the FSH blood test or the Follicle Stimulating Hormone blood test to check whether they are in menopause. Well, I'm going to tell you a few things about this. First of all, FSH is not the recommended test to diagnose menopause. While a certain level has been associated with menopause, this is not the best way to find menopause. With that being said, a level of FSH above 30 is generally considered to be an objective sign of menopause. So if you did your FSH level and it was more than 30, you can be considered to be in menopause. Secondly, FSH levels are not very stable between the age of 40 to 50, which is usually in the late 40s, the time when menopause actually sets in. So between the age of 40 to 50, it doesn't become very stable. It can fluctuate a lot, and so it's not that reliable. It takes a couple of years to actually settle down to a stable level after menopause. The next thing is that menopause itself means that you should not have had any periods for at least 12 months. That means no menstrual bleeding for 12 months, associated with symptoms like hot flashes, mood changes, depression, maybe a little bit of weakness and fatigue, and your age should be at least above 45. If all these things come together, a doctor might consider that you have menopause together with an FSH level of more than 30. That is more and more evidence of menopause. Also, if you have had any kind of pelvic surgery, by that I mean maybe you've had your uterus removed, like a hysterectomy, or maybe you've had a surgery for fibroids, any surgery that you've had in your stomach, in your pelvis, you should not measure the FSH level for at least 3 months after that surgery, because it is not reliable in that period. With that being said, there are also other tests like the AMH test and the estradiol test, and doctors would usually advise all these tests together with an ultrasound scan and your clinical symptoms to say that you are in menopause.